National Library of Medicine, April 24, 2018, stated that death involving prescription opioid rose from 3,442 in 1999 to 17,029 in 2017. For the first time, U.S. life expectancy have decreased compared to other developed countries. Today, I will persuade you why the regulation of opioid should provide the user with preventative measure when exposing to these powerful drugs. First, I will say why the patient seek out the drug in the first place. Second, I will say why physician is over-relying on the system and over-reliant on prescription opioid to alleviate pain. And third, I will say the preventative measure to opioid addiction. The risk of opioid addiction stems from the fact that patients need to alleviate symptoms of pain. To find out why patients seek out non-reliable sources, we first need to understand what opioids do to the brain. National Institution of Drug Users 2021 say that the opioid bind to the receptor that's registered for pain and pleasure. It blocks the signal to sending to the brain and creates a dopamine release. This will reinforce the activity of drug, and with the ease of importation and regulation of the drug, alternative like fentanyl and heroin appear in the U.S. market and easily accessible to the user. This contributes to the diversion of pharmaceutical sale and causing a widespread market for street distribution. According to National Health of Medicine, January 4, 2022, illicit heroin use is an international problem. It's also associated with hepatitis C and HIV infection. In the US, nearly 1/3 of the adults is using opioid as pain relief. The US consumes roughly 80% of all of the world opioid resources. And Surgeon General Volker Murphy say that the substance use is now more prevalent than common medicine disease. Opioid affect all sex, age, ethnic, and all social economic background, especially though in rural setting. A nationwide data from U.S. Poison Center West say in March 18, 2018, say that its epidemiological evidence indicate that over 65% of opioid overdose reports were indeed suicide attempts. And out of all these cases characterized as suicide attempt, it will climbing to 75%. So not only psychiatric pathology provided only a limited perspective, and dual disorder, addiction evaluation, specifically focus on individual with meet the criteria of major depressive disorder. Because because the under treatment of pain fueled the opioid epidemic. In 1980, one paragraph letter to the editor of New England Journal of Medicine, an influential major journal, challenged the practice of opioid only used for cancer pain. They stated that 4 out of 11,882 patients get addicted when using the drug. This leads to the expansion of opioid use for anyone that had pain. And they create the American Academy of Pain and Medicine issued the consensus statement that opioids should have a role in non-cancerous chronic pain. A number of physicians started to advocate more aggressive use of opioid. A study published in 1986, and they stated it's more humane to use opioid as pain relief when doing surgery. In 2010, the Patient Affordable Care Act expanded the role of patients as satisfactory program. When patient review and rating affect the hospital reward system and provide them with the hospital with resource and money, they started to prescribe more opioid for patients to satisfy their rating. This leads to a problem that over-reliant on opioid prescription. According to the International Medicine, a new healthcare system in the 21st century, that the system does not provide consistent, high-quality care for all patients. So the solution to prevent this, stated from Professor Ruman and his colleague in the delineation at Mayo Clinic, proceed March 2018, state that viewing addiction as a chronic relapsing disease, to undergo the evaluation, detoxification, and monitor the patient for at least 5 years. They stated consistent evaluation and treatment for psychiatric issue is needed to result in the abstinence of the not using the drug, and 80% of the drug working, 80% have worked. So it also stated that partnering with public safety official and community organization, including law enforcement, to equip with Nexanon, an antagonist to opioid, used in an emergency situation when people are getting overdose. They say that only 17 patients have died when get saved by Nexanon, according to the harm reduction of journal in January 9th, 2023. I hope that I have explained the why opioid should be regulated more strictly and more and why physicians should diagnose patients according to their symptom according